So now I'm going to introduce the true star of our program tonight, the NIH Director, Dr. Monica Bertagnolli. Monica, will you please join me at the podium while I just say a few things about you, because I'm so blessed to be working with you and to be able to be your friend. You know, we're grateful to have long-standing relationships with all of the NIH directors, including our board member, Dr. Zerhouni, the former director, Dr. Collins, who I mentioned is here tonight and is a huge champion of partner science. But we have had a long-standing relationship with Dr. Bertagnolli long before she was at NIH. And even before she was directing the NCI, she's been a true partner of several of the FNIH programs in cancer. So we know her, and we sure do love her. Monica, please. Thank you.
Thank you so much. Oh my goodness, thank you so much, Julie, for that kind introduction. And I am so delighted to be part of this very special celebration of science and how science can help people enjoy longer and healthier lives. The scientific opportunities, the tools, the potential that we now have at our disposal have never been greater. But solving today's complex health challenges requires teamwork. Cross-cutting research collaborations at the Foundation for the NIH and NIH create with our many partners across the biomedical ecosystem. No single lab or researcher, no matter how brilliant, can do this alone. And public-private partnerships are absolutely critical. Together, we are unlocking new approaches to treatment and cures and truly personalizing medicine as we learn more and more about human biology and the environment and how it dictates our health. The FNIH has been our long-standing partner in so many important programs, such as the Accelerating Medicines Partnership platform that identifies new platforms and new pathways and novel targets in diseases like Alzheimer's, heart failure, and schizophrenia. Today, we've also developed and led ACTIVE, the Accelerating COVID-19 Therapeutic Interventions and Vaccines Multi-Sector Partnership that so rapidly screened and evaluated promising treatments for COVID, even as the pandemic unfolded. This partnership is especially noteworthy for its incredibly large scale, involving 8 federal agencies, 20 biopharmaceutical companies, and 4 nonprofit organizations that screened more than 800 different therapies and enrolled 23,000 patients in 33 trials at more than 600 sites across an array of existing clinical research networks, all with breathtaking speed. So, an amazing accomplishment, but mostly a testament to the partnership it takes to succeed. We celebrate these and many other successes, but we are certainly not done. We look forward to continuing to work with the Foundation for the NIH on new priority NIH programs, such as Recover TLC, which will evaluate treatments for long COVID, and Care for Health, a program close to my heart that will improve access to clinical research and clinical trials among people in rural areas and other hard-to-reach communities, especially focusing on those people who are experiencing the terrible health disparities that make our overall success as a country much less than it should be. FNIH supports these and many other collaborations as a neutral convener, engages the necessary non-governmental stakeholders, oversees governance, and assures effective project execution. We simply could not achieve what we do without the Foundation for NIH. Last month, I took part in the inaugural Team Science Day with many of our partners from FDA life science companies, academia, and patient organizations. That day was so much fun. It certainly reinforced the health impact of collaborative work and the value of a wise crowd of diverse experts who share ideas and exchange experiences. FNIH is not only a key partner in supporting scientific programs, but also in the very critical development and recognition of scientists. We look at these scientific advances, these brilliant accomplishments, and we forget that was so many years of struggling, working, failing, trying again, ultimately succeeding, that led to these amazing breakthroughs. And the more we can celebrate those who are able to persist, continue, and give their brilliance to people who need them, the better. FNIH spotlights science superstars and research teams whose contributions are driving incredibly impressive progress in the discovery and translation of promising treatments. And that is exactly why we're here tonight. So, a couple more things. I extend a big congratulations to Julie and the entire FNIH team, to this evening's awardees, to all of you here tonight who have supported this event, and especially to those who are participating in our collaborative efforts to accelerate scientific discovery and translation. Together we can bring new treatments and hope to people everywhere. Before I finish, I'd like to take a moment to honor the memory of a very special person to NIH and to the scientific community, Dr. John Gallen. John's illustrious career at NIH spanned more than 50 years. In addition to leading the clinical center, which he referred to as the House of Hope, John was passionate about training the next generation of scientists. Tonight, I look forward to the presentation of the Trailblazer Prize, which John and his wife Elaine, who is here with us tonight, personally launched and funded to support career clinician scientists. John was a treasure, and the NIH community, indeed all of the biomedical research community, will miss him dearly. So now, can I ask you, please, stand with your glass, and let's raise a toast. Ready? To Dr. John Gallen. Thank you very much.
That was a beautiful tribute, and we'll have more words to say about John as the evening progresses.